I go and visit people at home. So if I started noticing something, or if they said to me on one of my visits, but I would usually ask them the question, and I usually actually just observe them, because when I go they'll say to me, would you like a cup of tea? And I say, yes please. So they make me a cup of tea. So when they're having a drink, I'm actually observing their swallow, sort of without saying to them, I'm I'm watching what you're doing. So I'm observing, and if I see anything sort of maybe cough or a splutter, or they don't, don't manage it very well, or the swallow seems difficult, I will then say to them, are you having difficulties? I notice, that you coughed a little bit then when you were, and, they'll often deny that there's a problem. Oh yes, it just sort of went down there a way, but it's okay, I'm not really having difficulty swallowing. And I can then talk to them about it and say, well, really, I think, we need to sort of contact the speech language therapist, or sometimes it's the dietitian, or I'll say both really need to be involved, so that they can just have a look and check that your swallowing's okay, that they can see you, because you run the risk of a chest infection. And getting in early, getting in before somebody gets a chest infection, is having real difficulty swallowing, or starts to lose weight. That's the other thing, because obviously if they're not eating very well, that they're going to start losing weight, and fatigue is a big part of MND. So sometimes they can say, oh, my appetite's gone a bit, or oh, I get tired before the end of the meal, and then I would be saying, well, I think we'll have a word with the dietitian, and she'll be able to tell you how to get a lot of calories into a small amount of food, because it's important you keep your calories up and you keep your weight up. So sort of, that would bring in the dietitian side of it as well.